familiar faces. That's a pleasing welcome to what I know is going to be a great conference. Coming together is a beginning. Keeping together is progress. Working together is success. So we are heading towards the journey of success today.
Jai Hind, Namaskar, Adab and a very good morning. हम फिदाए लखनऊ मुस्कुराइए मुस्कुराइए आप लखनऊ में हैं लखनऊ the city known for its तमीज तहजीब and architecture, the tomb and the pillar. For its Lucknowi Jardoji, also called as chikangari, and of course, mouth-watering, delicious food.
On behalf of Baba Educational Society, myself, Mrs. Manita Acharya, Professor, Baba College of Nursing,
and myself, Manila Bibin, Assistant Professor, Baba College of Nursing,
take this extreme privilege to warmly welcome you all. The world is full of diamonds and gems, and we are having some of them over here. And they are making our event successful. So thank you all.
With this note, I would like to give my hearty welcome to our dignitaries, our eminent speakers, our evaluators, our moderators, our director sir, our principal ma'am, faculty members, and all delegates or participants, and all media persons on the first day of our international conference.
Now, I would like to welcome our Honorable Chief Guest, Mr. Alok Kumar, IAS, Sir Principal Secretary, Medical Education, Uttar Pradesh, who is a man of distinct vision and inspiration to all of us. But because of some official reason, he could not be physically present here, but he will be soonly joining us virtually.
Now, I would like to welcome our guest of honor, Dr. Alok Kumar Sir, Secretary, Registrar, UP State Medical Faculty. I kindly request our Director Sir, Mr. R.K. Vajpayee Sir, founder of Baba Educational Society, to welcome him with a bouquet. I request Dr. Alok Kumar Sir to kindly occupy the seat on the dais.
Thank you, sir. Now I feel very glad to welcome our guest of honor, Dr. Ashok Kumar Bisnoi, sir, Professor and Dean, Nursing Faculty, Atal Bihari Vajpayee Medical University. And I kindly request Mr. Nitin Soni, sir, Professor, Baba College of Nursing, to welcome him with a bouquet. I request Dr. Ashok Kumar Bisnoi, sir, to kindly occupy the seat on the dais. Sir, please. Thank you, sir.
Now, with great pleasure, I would like to welcome Professor Dr. Manju Chugani ma'am, Dean, School of Nursing Sciences and Allied Health, Jamia Hamdard, New Delhi, as our guest of honor. I kindly request our principal ma'am, Professor Dr. Archana Chauhan ma'am, to welcome ma'am with a bouquet. I request Professor Dr. Manju Chugani ma'am to kindly occupy the seat on the dais. Ma'am, please. Thank you, ma'am. Now, I would like to extend my hearty welcome to Professor Dr. Usha Okande, ma'am, Director, Edu, Serumax, Nursing College, Indore, Madhya Pradesh, as our guest of honor. I kindly invite Mrs. Manita Acharya, ma'am, to welcome her with a bouquet. Thank you, ma'am. I request Professor Dr. Usha Okande, ma'am, to kindly occupy the seat on the dais.
Now, I would like to welcome our Pattern Director, Sir, Mr. R.K. Bajpai, Sir, and I would like to request Mr. Hemendra Pal Singh, Professor, Baba College of Nursing, to welcome him with the bouquet. I request our Director, Sir, to kindly occupy the seat on the dais. Sir, please. Thank you, sir.
Now, I would like to welcome our principal ma'am, Professor Dr. Archana Chauhan ma'am. I kindly request Mr. Hemendra Pal Singh sir, Professor, Baba College of Nursing, to welcome ma'am with a bouquet. I kindly request principal ma'am, I kindly request ma'am to occupy the seat on the dais.
Thank you so much, ma'am. Now, I would like to welcome Mrs. Bhumika Singh, ma'am, Secretary, UP State Branch, TNAI. And to welcome her, I would like to invite Mrs. Manila Bibin, ma'am, Assistant Professor, Baba College of Nursing, to welcome her with a bouquet. I would like to request Mrs. Bhumika Singh, ma'am, to kindly occupy the seat on the dais. Thank you, ma'am.
Now, I would like to extend my gratitude to Mr. Srikant sir from EBAC team. He has supported us to conduct this conference.
Thank you, sir. Now we are heading towards our lamp lighting ceremony.
Shubham karoti kalyanam, arogyam dhana sampada, shatru buddhi vinashaya, Deepa Jyoti Namostute. Deepa Jyoti Parabrahma, Deepa Jyoti Janardhana, Deepo Mehara, To Papam, Deepa Jyotir Namostute. Light is considered as a symbol of auspiciousness, prosperity. Light brings brightness with it and removes the darkness.
So I kindly request our all dignitaries and Director Sir and Principal Ma'am to kindly inaugurate our program by enlightening the lamp. Ma'am and Sir, please. because of busy schedule, Alok sir has to leave. That is why I request our director sir to present a memento to our respected guest of honor, Dr. Alok Kumar sir, Secretary Registrar, UP State Medical Faculty. Thank you, sir. I request our respected guest of honor, Dr. Alok Kumar, sir, to address the gathering with his valuable words. Sir, please.
Good morning, all of you. It's wonderful to see you all over here in this wonderful college, prestigious college, and I am very much thankful to the your patron, Mr. Bajpayee ji, to give me this honor to address you, all the dignitaries on the dais and delegates, distinguished speakers, and dear students. आप लोगों के इस कॉलेज में ये पता नहीं, ये शायद फर्स्ट इंटरनेशनल है, पहली बार आपके यहाँ इंटरनेशनल कॉन्फ्रेंस हो रही है एंड आप लोग इतने भाग्यशाली हैं। सबसे पहले तो आपको बधाई कि आपके कॉलेज को ए ग्रेड मिला है। उसके अलावा जितने भी नए नए काम हो रहे हैं, जो भी नए नए डेवलपमेंट हो रहे हैं, रिफॉर्म्स हो रहे हैं, उनमें बाबा स्कूल सबसे पहले रहता है। बाबा स्कूल ऑफ नर्सिंग नाम ही हो गया है, मतलब ये एक ब्रांड बन गया है अब। तो आप लोगों को इस पर खुश होना चाहिए और यहाँ तक वाजपेयी जी इसको लेकर आए हैं और आगे भी लेकर जाएंगे। लेकिन आप लोग यहाँ से निकल के जब शिक्षा प्राप्त करके निकलेंगे अलग अलग जगह, तो जितने भी मान लीजिए किसी भी हॉस्पिटल में, किसी भी नर्सिंग कॉलेज में या फिर किसी भी इंस्टीट्यूशंस में अगर 50 स्टाफ हैं, 50 नर्सेज़ हैं, तो उसमें यहाँ की नर्सेज़ अलग ही डिस्टिंग्विश होनी चाहिए, अलग ही पहचान होनी चाहिए कि हाँ ये बाबा कॉलेज की नर्सेज़ हैं। और मैं आप सबको बधाई देता हूँ। अनफॉर्चुनेटली दुर्भाग्यवश मैं ज़्यादा समय नहीं दे पाऊँगा क्योंकि कुछ और मीटिंग्स हैं, जानते हैं वाजपेयी जी, तो मुझे जाना पड़ेगा। मैं आप सबको बधाई देता हूँ, बहुत बहुत धन्यवाद, बहुत बहुत शुभकामनाएं।
Thank you so much, sir, for your valuable words. We are really blessed to have your presence, sir. The aim of art is to represent not the outward appearance of things, but their inward significance. Now we are heading towards our souvenir launch, and I request our director, sir, principal ma'am, and all our dignitaries on the dais to launch our souvenir for this international conference. Sir and ma'am, please. Thank you, sir and ma'am. Thank you so much. Thank you so much, sir. We are really blessed with your presence. Despite of your busy schedule, you gave your time to us. We are really thankful for you. Thank you so much, sir.
If everything was perfect, you would never learn and you would never grow. Now, I would like to invite Mrs. Manita Acharya ma'am, Professor, Baba College of Nursing, for theme unfolding. ये कनेक्ट करोगे ना?
Thank you, Manila ma'am and Baba College of Nursing for providing me this opportunity to unfold the theme of this two-day international conference. And the theme for this conference is Let's Embark Treating Labor and Childbirth as a Natural Event, heading towards diverse modalities of painless delivery and water birth, followed by colostrum harvesting. The team behind the organization of this conference are, firstly, our patron sir, Mr. R.K. Bajpai sir. Sir is founder of Baba Educational Society, director of Baba College of Nursing, and president of UP Nurses Association, and he is also the backbone of our institution. Secondly, our team includes our chairperson, Professor Dr. Archana Chauhan ma'am. She is principal of Baba College of Nursing, Baba Educational Society, Lucknow. She is a dedicated dynamic personality with immense capacity of excellent administration, management, and teaching skills. She is a true leader with integrity, insight, and inclusiveness. She is PhD, MSc Nursing, and having more than 14 years of administrative, management, and teaching experiences. She developed so many colleges under her guidance, and also she received an award as head of Mentor Institute to running one and only first Mentor Institute of Lucknow under her guidance from our CM Yogi Adityanath ji. She is also a chairperson of NEC. She, as a speaker, participated in so many national and international conferences. She is a successful author and also editor and reviewer of so many books. She is inspector, examiner, and involved in so many government and non-government activities. She also developed so many formats and a smart way to provide quality education to the nursing students. She is also a trainer of simulation, HIV/AIDS, hepatitis, COVID-19, and many more. She is always promoting health and become two-time brand ambassador of Lucknow City Half Marathon. Now, heading towards our speakers, we are having keynote speakers from all around the world. First, we are having Professor Dr. Manju Chugani ma'am, Dean School of Nursing Sciences and Elite Health, Jamia Hamdard, New Delhi. Then we are having Professor Dr. Usha Ukande ma'am, Director, Education Ceramics X, Nursing College, Indore, Madhya Pradesh. We are having Dr. Adela Hamilton ma'am, Darzi Fellow, Clinical Education and Development Lead from UK. We are having Mrs. Karen Dratton, International Midwifery Educator, Walsall, UK. We are having Ms. Renata Grabli-Yunen, International Midwifery Educator, Lithuania, UK. We are having Dr. Nita Rajesh Vide, Professor cum HOD from SGT University, Gurugram. We are having Professor Nima Bhaskar ma'am, Vice Principal, College of Nursing, Ayodhya. We are having Ms. Renuka GB ma'am, National Midwifery Educator, National Midwifery Training Institute, Meerut. We are having Ms. Rukshana Khatun ma'am, Mentor of Siddharth Nagar. we also conducted pre-workshop for our international conference. Sorry. The theme of pre-workshop was Sustainable Menstruation, Drill and Academia, and with the help of God grace and support of you all people, it turned out to be a great success. And approximately 800 students participated in our workshop, which was held yesterday, that is 11th of August, and were benefited with the session. And the session was conducted by Dr. Pranita Sarma. She is a national instructor and head of Parinita Welfare Society. Now, coming to the session of our international conference, so today is day first. So day first we are having 5 sessions. The first session is being held by Professor Dr. Manju Chugani ma'am, Dean School of Nursing Sciences and Allied Health, Jamia Hamdard, New Delhi, and she is conducting her session on concept of natural birthing. Second session is being held by Professor Dr. Usha Ukande ma'am, Director EDU Ceramics Nursing College, Indore, Madhya Pradesh, and she is conducting her session on preparing the women for natural birth and protecting their rights, the first step towards natural birthing. Our third session is being taken by Dr. Adila Hamilton, Clinical Education and Development Lead, UK, and she is conducting her session on introduction of hydrobirthing and procedure and setup of hydrobirthing. Our fourth session is being conducted by Ms. Karen Drayton, International Midwifery Educator, Walsall, UK, and she has taken her session on antenatal exercises towards normal birth. Our fifth session of today is being taken by Ms. Renata Grabli-Yunen, International Midwifery Educator, London, UK, and Lithuania, UK, and she is conducting her session on natural childbirth, the continuum of labor and positioning in this context. So moving towards our second day, that is 13th of August, we are having two sessions and one panel discussion. So session 5 will be taken by Ms. Renuka GB, ma'am, National Midwifery Educator, National Midwifery Training Institute, Meerut, and she is taking her session on respectful maternity care guidelines. Our sixth session will be taken by Dr. Neeta Rajesh Bhide. She is professor cum HOD from SGT University, Gurugram, and she will be taking her session on colostrum feeding and harvesting. Next session will be followed by panel discussion, and panel discussion will be taken by Ms. Renuka GB ma'am, Professor Nima Bhaskar, Ms. Renata Grabli-Yunen, and Ms. Rukshana Khatun. And the panel discussion will be on painless modalities for normal delivery. So these all are our session for 2 days. And now talking about the necessities, why there is needed for awareness of our topic, then if we want the advancement in our India, then we need to be aware the people regarding this topic. Because if we compare our country with other country in the world, then the practicability related to hydrobirthing and other painless modalities are much more higher than in India. So if we talk about the knowledge level of people in India regarding painless delivery, then it is very poor. The people only know about epidural as painless modalities. People lacks knowledge regarding diverse modalities like aromatherapy, back massages, and all. So we felt the need for creating awareness in people. And the myth in India is still high. Still the people of India feels not to feed the colostrum to the newborn babies. Although the colostrum contains antibodies which is necessary for newborn. That is why we felt need to create awareness regarding various painless modalities, hydrobirthing, and colostrum feeding and harvesting. So, hope this conference will be beneficial for you all. Thank you.
Thank you very much, ma'am, for enlightening our 2 days international conference. Now, moving towards, welcoming is an integral part of any ceremony. So hereby, I kindly request Professor Dr. Archana Chauhan, ma'am, Principal and Chairperson of this conference, who leaves no stone unturned pertinent to make this event a grand one, to address the gathering. Ma'am, please.
A very good morning to all. Welcome to the Baba College of Nursing. To welcome is to show honor. To welcome is to establish integrity. I take this privilege introduce our chief guest, Mr. Alok Kumar, sir. Sir is Principal Secretary of Medical Education, Uttar Pradesh. He is the backbone of Mission Niramaya, which is launched by our respected CM Yogi Adityanath ji in 2022. Under his supervision and guidance, UP is growing day by day. Now, Uttar Pradesh has become a first state who is graded by rating system. And we are continuously working towards improvement of quality of nursing education. Unfortunately, due to some unavoidable reasons, he is not here, but his blessings are always with us. I welcome our guest of honor, Dr. Alok Kumar, sir, Secretary UP State Medical Faculty and Registrar of UP Nursing Council. As head of UPSMF, he is leading the Mission Niramaya with the help of Japaigo. Due to some reason, he also left us. Thank you, sir. I also welcome our guest of honor, Dr. Ashok Kumar Bishnoi, sir. Sir is Professor and Dean of Nursing Faculty, Atal Bihari Vajpayee University. He is Additional Controller of Examination Body of Atal Bihari Vajpayee University. He is also a lifetime member of a Nursing Research Society of India, an international network for doctoral education in nursing. Welcome, sir. I welcome our guest of honor, Professor Dr. Manju Chugani, ma'am. She is Dean, School of Nursing Sciences and Allied Health, Jamia Hamdard, New Delhi. She is a prestigious leader, trainer, researcher, and influential academician with more than 30 years of experience in the area of maternity and child health and university teaching and administration, project manager, and researcher. She is certified assessor of National Assessment and Accreditation Council, NAC. Thank you, ma'am, and welcome to the Baba College of Nursing. I welcome our guest of honor, Professor Dr. Usha Ukande, ma'am. She is Director, EduCeramics Nursing College, Indore, Madhya Pradesh. She has more than 50 years of professional experience on nursing, midwifery practices, academics, research, and administration. She is recipient of various awards and honor like Hall of Fame by Nursing Honor Society of India. Welcome, ma'am. I also welcome Mrs. Mary Malik, ma'am, President of State Branch TNAI. TNAI endorsed total 3 credit points for this conference and pre-workshop. Due to some personal reason, she could not be present here, but TNAI representative, Mrs. Bhumika Singh, is here. She is Secretary of TNAI. Welcome, ma'am. I also welcome Shrikant sir from EBEG team. He has also supported us and conducted this conference. I also welcome all the supporters. I am extremely delighted to stand here and deliver few of my words on the auspicious event. Baba Educational Society is extremely delighted in organizing an international event and imparting knowledge with you all with our keynote speakers that gathered here from different countries. Welcome you all. It is a matter of great pleasure to introduce Baba College of Nursing. The Baba College of Nursing, an institute of paramedical founded by our director sir Mr. R.K. Bajpai sir, and it is managed under Baba Educational Society, established in the year of 1999. It is a first college who is recognized by INC in Uttar Pradesh in 2003. Courses running under this society are ANM, GNM, BSc Nursing, MSc Nursing and other paramedical courses. This is the only institute of Uttar Pradesh which is having biggest intake capacity of 140 BSc Nursing student per year and 40 MSc Nursing per year. Baba College is only independent nursing college that is accredited by the National Assessment of Accreditation Council NAC since 2022. The College of Nursing earned itself the title of being first mentor institute in Lucknow, awarded by our Honorable Chief Minister Shri Yogi Adityanath ji under Mission Niramaya, which is launched in 2022. After Mission Niramaya, Baba College is fulfilling its responsibilities of being a mentor institute, and it is constantly striving to take its standard and speed activities of the college to a new level. Baba College is also received the prestigious grading A from Quality Council of India under Mission Niramaya. Our institute is also a part of Student Nurses Association of India and involved in so many activities organized by SNAI. Baba Educational Society is dedicated towards working for welfare of society since so long. The atmosphere of this institute is conducive to creative and productive learning. The college really cares its member. It is a place of civility, friendship and good cheer. We as Mentor Institute are also supporting other Mentee Institute to grow with us towards improvement in quality education. And by the God grace, we are having total 22 Mentee Institute under us who are growing and improving day by day. I also welcome our Mentee Institute to our college and appreciate their efforts regarding their student and teacher participation in this conference. My aim towards organizing this conference is to explore the latest research, trends and best practices in natural birth, and also to identify the challenges and opportunities in the field at present. This conference offers opportunity for you all to hear from renowned professionals and experts from all over the world who exchange their insight and perspectives on a variety of topics related to women's health and midwifery. I hope the conference is being useful and inspiring for all and look forward to engaging with you over the coming days. Thank you for joining us. Thank you so much for coming. Thank you.
Thank you so much, ma'am. Thank you for your valuable words. To become an effective listener, you need to learn power of silence, as silence gives you opportunity to think about what is being said before you respond.
I request Mr. Gagan sir, Professor, Baba College of Nursing, to present a memento to our respected guest of honor, Dr. Ashok Kumar Bishnoi sir, Professor and Dean, Nursing Faculty, Atal Bihari Vajpayee Medical University.
Gagan sir. Okay, Mr. Nitin Soni sir. He is coming. Sir, please present a memento to our guest of honor, sir, Ashok Kumar Bishnoi, sir. Thank you, sir.
Now I request our guest of honor, Dr. Ashok Kumar Bishnoi, sir, Professor and Dean, to address the gathering.
Sir, please.
A very good morning to one and all present over here, dignitaries on the dais, off the dais, respected chairpersons, resource persons, and dear participants of this international conference. At the outset, I would like to give my sincere thanks to the Baba Education Society's director, Sri Bajpayee ji, and the principal for inviting me in this occasion. And it's very heartening to share with you that this institute is having many achievements to its credit. And we wish that these institutes will be growing in the future and will be becoming a role model for the other institutes also in the future. And I think this is their first international conference, and especially like they are focusing on the maternal health and midwifery education. Just I was going through the report which was published by the Lancet, which was, it's been mentioned that if we are having the well-trained midwives or midwifery practitioners, 80% of the work of maternal and child care can be managed by them very effectively without putting the load to the hospital and the tertiary care centers, especially the obstetricians and the tertiary care centers. So, like this is the time where we should train the independent midwifery practitioners so they can manage the maternal and child care of this country as well as of the globe. We have seen there is a huge scarcity of the nurses, especially the trained midwives throughout the world. The WHO also, like to achieve the sustainable goal by 2030, it is estimated that there will be requirement of 9 million additional nurses to achieve those goals. And if you are talking about these maternal mortality rates, MMRs, so SGD they have expected to achieve the rate of 70 per lakh live birth of the MMR by the 2023. And I think it is only possible when like we will be having the efficient, trained, independent midwifery practitioners. INC also have launched a course about the for the nurse practitioner in midwifery, and I think that course will be already implemented and will be implemented. And from the various platforms we are lobbying with the government, like they should create a separate cadre for the midwives throughout the country. So there will be more takers for this course and they will be able to manage. If we are having the well-trained midwives or midwifery practitioners, so it will help to improve around 50 parameters of maternal and newborn care, which includes like maternity care, child, pediatric problems, their genetic problems, sexual and reproductive problems. So these all problems can be dealt by the nurse practitioners in midwifery. So we need to focus on this. And also like we need to have the centers where they can take up these midwifery courses and train the people, and again like they can establish the training centers for the efficient midwifery care throughout the country. So institute like this, they are having a very good hospital, and the other institute, they should take the advice from the mentors. I know Madam Manju Chugani, moreover as a midwife rather than a nurse. So she is actively involved into the midwifery practitioner since I know her since my beginning of my professional career. So I think we need to have those more number of the enthusiastic nurse practitioners. So hope that soon the government will be creating the cadre for the nurse midwives, and there will be more takers. Recently, INC has accepted the proposals from different institutions and governments, and they will be like approving the MSc nursing students as a kind of a resident for any institute. I was working at the AIMS since last 10 years, where we are using the MSc nursing students as a full-time resident in our hospital. They are being posted in the hospital round the clock, and they are getting the stipend of the 15,000 per month. So we are having the adequate number of takers for the MSc nursing course. Similarly, for the eligibility, like earlier in the AIMS it was that anyone is having a 3 year of teaching experience will be counted for the post of tutor or any faculty post. So we have changed that to the experience in a teaching institution. Means a person if can work in the clinical side also, he will be eligible to apply for the teaching post, because teaching is not complete without the clinical practice. So similarly, those candidates are the MSc nursing aspirants in the future will be used as a resident, their experience will be counted, and they will be paid a starting stipend of 15,000 during their entire course. So I think this will create the more takers, and also like we have proposed from the AIMS, like it will be started in the AIMS. Like for example, if you are having 1,000 posts of nursing officers sanctioned, so we have requested the government at least 25 to 30% of the post to be reserved for the specialty nurses, like critical care nurses, okay, and community health nurses, the pediatric nurses or neonatal nurses. So, and their pay scale should be one scale higher to the existing nursing officers. So there again, like there will be more taker for the specialty courses in the nursing, and there will be like we can do. And again, I am requesting, because there are many leaders from the nursing colleges are sitting over here. Please be the responsible college throughout the state, and I think UP state is now flourishing, especially in the nursing education. So we can be a role model for throughout the country. So we should present our model towards the country, like we are having the rating system. This system in the future, it will be more robust, and like students can select the colleges based on their rating. So similar thing, other states should copy from us, and they in the future they will also implement this model in their respective state. So again, thank you very much for inviting me here, and I wish that these 2 days of the conference will be very useful, and after that, like you will be doing the brainstorming, and we will be improving the midwifery education not only in India but throughout the globe. Thank you once again. Thank you.
Thank you very much, sir, for your valuable and inspirational words.
Now, with the continuity of presenting memento, I request our Principal Ma'am, Professor Dr. Archana Chauhan, to present a memento to our respected guest of honor, Professor Dr. Manju Chugani Ma'am, Dean School of Nursing Sciences and Allied Health, Jamia Hamdard, New Delhi. Thank you, ma'am. I request Dr. Manju Chugani ma'am to please address the gathering with her valuable words. Ma'am, please.
हिंदी में बोलना चाहूँगी पहले। नमस्कार, आदरणीय मिस्टर आलोक कुमार IAS ऑफिसर, उनकी अनुपस्थिति में उनका भी बहुत बहुत धन्यवाद करना चाहती हूँ, क्योंकि उन्होंने कंसेंट तो दिया था पर आ नहीं पाए, बट इट्स अ ऑनर, वो आना चाहते थे। गेस्ट ऑफ ऑनर हमारे जो हैं डॉक्टर आलोक कुमार जी, जिनको अभी हमने थोड़ी देर पहले ही सुना, सेक्रेटरी मेडिकल फैकल्टी यूपी स्टेट। डॉक्टर अशोक कुमार बिश्नोई प्रोफेसर हैं और बहुत वाइब्रेंट लीडर हैं। मुझे वो पता है उनके बारे में कि वो बहुत वाइब्रेंट लीडर हैं, एक्टिव हैं और ज़िंदगी में कुछ कर गुजरना चाहते हैं। तो ऐसे सभी हस्तियों का बहुत इम्पोर्टेंस होती है हमारे जीवन में, हमारे पर्सनल लाइफ में भी और प्रोफेशनल लाइफ में भी। तो इसलिए उनको भी मैं बहुत मानती हूँ। और हमारी उषा जी हमारे बीच हैं, और उनका नाम क्या था मैडम का? नो द लास्ट वन, टी नहीं, भूमिका जी। तो सभी को मंच पर आसीन और सभी गणमान्य अतिथिगण जो मैं सामने बैठे हुए देख रही हूँ, और हमारे बहुत इंटरनेशनल स्पीकर्स यहाँ पे उपस्थित हैं। आई एम सेइंग दैट ऑल इंटरनेशनल स्पीकर्स आर इनक्रेडिबल and they are here for us. That's our honor. So I am speaking in Hindi because that I love. Okay? I hope you don't mind that. Yeah. Thank you so much. So coming to, I was not prepared to see all this. ये इतना बड़ा मंच और एक इंटरनेशनल कॉन्फ्रेंस, और मुलाकात हुई यहाँ पे मेरी वाजपेयी जी से, जो मैं कह रही हूँ कि वो ऐसा लगा मुझे उनसे 10 मिनट भी अभी बात नहीं किया है टोटल, बट आई फील दैट ही हैज़ दैट एनर्जी, ही हैज़ दैट विल, जो कर गुजरने की एक इच्छा होती है वो है। और हमने अभी अभी 2 सेकंड पहले एक बहुत इम्पॉर्टेंट काम के लिए उनसे हाँ करवाई है, वो अभी नहीं बताएंगे, जब वो होगा मैं फिर वापस आऊँगी यहाँ पे और तब वो काम होगा। तो अगर मुझे लगता है कि वाजपेयी जी जैसे लोग अगर लीड कर रहे हैं और आपकी जो प्रिंसिपल हैं अर्चना ये इम्प्लीमेंट कर रहे हैं, मुझे नहीं लगता कि यूपी को कोई भी रोक पाएगा। अब I am fully convinced that it is going to grow, and all new things which we are expecting at the national level is going to happen here. पहले बहुत साल पहले की बात है, एक जपाईगो के साथ एक था प्रोजेक्ट, तब उन्होंने ये पूछा कि क्या आप यूपी में जाके ये 72 डिस्ट्रिक्ट में करना है, करेंगी क्या? आई वॉज फर्स्ट कंसल्टेंट ऑफ जपाईगो इन इंडिया। इंडिया में जब जपाईगो ने स्टार्ट किया था मैं उनका फर्स्ट कंसल्टेंट थी। तो उन्होंने जब मुझसे ये सवाल पूछा, मैंने कहा देखिए यूपी में तो बहुत मुश्किल है करना, पर मैं आज अपना सेंटेंस चेंज कर रही हूँ, यूपी में करना आसान है। सो ये बहुत ही मतलब ये बदलाव एक बहुत बड़ा चेंज मैंने आपको कहा, क्योंकि ये आसान काम नहीं है, बहुत लोगों की इसमें मेहनत, बहुत लोगों की इच्छा शक्ति है। और मैं कहूँगी कि जो देश में जो इच्छा शक्ति की बात है, जो पावर ऑफ थॉट है, जो पावर ऑफ थिंकिंग, इमेजिनेशन एंड इट्स रिजल्ट्स हैज़ स्टार्टेड फ्रॉम इंडिया, एंड आई एम प्राउड ऑफ दैट। जो हमारा आदि सनातन देवी देवता धर्म जो हम बोलते हैं, वो वहाँ पे वो जो सोच है, वो जो विचार शक्ति की जो पावर है, वो वहाँ से शुरू हुई। और नेचुरल बर्थ को मैं उसके साथ कनेक्ट करती हूँ हमेशा, कि वो जो नेचुरल बर्थ आप कहते हैं कि ये इस देश से आया, उस देश से आया, ना, मैं नहीं मानती उसको। और मैं कहती हूँ ये हमारे आदि सनातन देवी देवता धर्म की शुरुआत थी, तब से था ये। और जो चीज़ें मेरे उस सेशन में मैंने इंटरनेशनली बोलने के लिए सोचा, ही चला गया ना शायद, कोई बात नहीं। ओह, लाइट चली गई ना। ओह, जो उस समय की चीज़ें हैं मैं आपको रिकॉल कराऊंगी मेरे सेशन में। मैंने इंटरनेशनल वाला कंपोनेंट डाला है अपनी पीपीटी में, बट मैं उसको बहुत फोकस नहीं करूंगी क्योंकि मैंने इंटरनेशनल स्पीकर्स यहाँ पे देख लिया, दे आर गोइंग टू स्पीक ऑल दैट। मैं अपना पुराना जो जहाँ से इसकी शुरुआत हुई और उसको किस तरह हम प्रोफेशनलिज्म में डाल सकते हैं, उस चीज़ को जो हम करते आए हैं पहले से, उसको बीच में भूल गए थे, आज फिर से याद करेंगे तो वही चीज़ होगी। और जैसा कि हमारे देश में ये बहुत ही सोचा जाता है कि जिसके मन का भाव अच्छा है उसका जीवन में हर काम सच्चा और अच्छा है। मन का भाव इज़ गिवन लॉट ऑफ इम्पोर्टेंस। आई एम टेलिंग यू दैट communication happens without words, without gesture, posture, still communication happens. If you are sitting in a hall and thinking that you can influence this, that thought itself will lead to many people think that yes, this person is very powerful. Power is not from position, leadership is not by position or post, it is by your thinking, it is by virtues you have influence others and work for others. Leadership is not only influence or power of dadagiri, it's a power to influence others, it's a power to go ahead with the risk taking, it is power to handhold people, it is a power to support people whenever they need you. I wanted to tell you a small story, अगर टाइम देंगे तो 2 मिनट देंगे सर? ओके। एक छोटी सी कहानी है जिसका मैंने बताया था कि जिसका भाव सच्चा है उसका जीवन में हर काम अच्छा है। देयर वॉज अ पर्सन जिसको मेरी तरह ना आम बहुत पसंद थे, एक लेडी को। उसने हस्बैंड ने रिटायरमेंट के बाद घर लिया, जो घर के पीछे बगीचा था और उसमें आम लगते थे। जिसने सुनी हुई है ये स्टोरी वो मुस्कुरा रहे हैं ऑलरेडी ऑडियंस में, बाकी बाद में मुस्कुराएंगे, नो प्रॉब्लम। तो उन्होंने वो मकान लिया, पर उनके दोस्तों ने कहा यार तुमने वास्तु वाले से तो पता ही नहीं किया कि ये मकान ठीक है कि नहीं तुम्हारे लिए। तो उसने कहा चलो वास्तु वाले को बुला लेते हैं एक। तो दिल्ली से वो वास्तु वाले को लेने आए, वास्तु शास्त्र के विशेषज्ञ को लेने आए, और उस विशेषज्ञ ने रास्ते में उनका बिहेवियर देखा इन जनाब का। तो वो गाड़ी चला रहे थे, और गाड़ी जब हाईवे पे चलती है तो बहुत गाड़ियाँ ओवरटेक करती हैं, तो उनकी गाड़ी को भी कई गाड़ियाँ ओवरटेक करती थी, और उन्होंने हर गाड़ी को ओवरटेक करने दिया। तो उन्होंने देखा कि ये आप हर गाड़ी को ओवरटेक करने दे रहे हैं। तो उन्होंने कहा कि ओवरटेक कब किया जाता है? जब जल्दी होती है या किसी को अर्जेंट काम होता है। तो शायद इन लोगों को होगा अर्जेंट काम, मुझे तो घर पहुंचना है और आपको अपना व्यूज़ लेना है कि वेदर इट इज़ करेक्ट और नॉट द वन विच आई हैव। ओके, दैट वाज फाइन। देन दे मूव्ड फर्दर, और आगे गए तो सकरी गली आ गई, घर के पास पहुंचने वाले थे। एक बच्चा तेज़ी से निकल के आया, क्योंकि स्पीड तेज नहीं थी तो वो स्टॉप कर पाए, और उन्होंने स्टॉप करके फिर 2 मिनट और रुके रहे। ये फिर देखा इसने बड़े आश्चर्य से उसको कि ये फिर रुक गया, ये कर क्या रहा है ये यहाँ पे। तो उन्होंने कहा इतने में एक और बच्चा निकल के आ गया। तो उन्होंने कहा मैं इसलिए रुका था क्योंकि बच्चा कभी अकेला नहीं खेलता है, कोई ना कोई साथ होता है। ये भी बच्चों से सीखने की बात है। इन बिटवीन एक और मैसेज। और जब वो और आगे गए, घर के पास गए, पार्क कर दिया, तो पार्किंग करके भी गाड़ी में बैठे नहीं निकले। तो उन्होंने कहा अब क्या हो गया? तो उन्होंने बताया कि अभी बहुत सारे पंछी उड़े हैं पेड़ के ऊपर से, इसका मतलब कुछ बच्चे वहाँ पे वो आम तोड़ रहे होंगे, और वो कहते हैं कि हम तोड़ रहे हैं, मैं कह रहा हूँ ले रहे हैं, ये भी फ़र्क है। और उनको ले जाने दीजिए, नहीं तो हम पहुँच जाएंगे तो कोई बच्चा जल्दी में गिर जाएगा और उससे नुकसान हो जाएगा। तो क्या कहने का भाव है? उनका भाव इतना अच्छा था। उसने कहा कि मुझे आपके घर में अंदर घुसना ही नहीं है, क्योंकि आपका तो भाव इतना अच्छा है तो आपका तो हर काम अच्छा होगा। सो that is what is required for midwifery. Why I am telling you this story? कि अगर midwife, if a midwife is thinking, having that positive thinking that yes, I am going to deliver this mother normally, you are going to deliver that, giving her that confidence that yes, it can be done, is one very important thing. वो सोच से होता है। आपके घर में कभी कभी मेहमान आते हैं तो सोचते हैं यार ये रात को क्यों आ गए इस टाइम। बाहर से क्या कह रहे होते हैं उनको, रुकिए ना, खाना तो खा के ही जाइएगा, है ना? ऐसा होता है ना, खाना खा के जाइएगा। पर वो जो आप मन में सोच रहे हैं और जो बोल रहे हैं, उसमें से कौन सा मैसेज वो लेके जाता है, कौन सा कैच करता है? जो अंदर चल रहा है, दैट इज माइन्यूटली परसीव्ड बाय दैट पर्सन, एंड आप कितना भी कहिएगा मुंह से, वो नहीं रुकते। एक बार अगर मन में आप करके देखिएगा, मेरा ये एक्सपेरिमेंटेशन, रिसर्च, एविडेंस कलेक्ट करिएगा, इस पे मैं दावे के साथ बोल रही हूँ आपको, ये किसी दिन करके देख लीजिएगा। ये जब आप मन में सोचेंगे, भले मत बोलिएगा, वो कहेगा कि चलो खाना आज आपके साथ ही खा लेते हैं। है सिंपल बात, लेकिन इसका महत्व बहुत बड़ा है। वही कहना चाहती हूँ, मेरा मैसेज भी वही है एक्चुअली। द वे यू लिव इन योर लाइफ इज़ अ मैसेज which inspires more than your words and your even actions. Your thought inspires more than your action and words. That's what I believe, and I do that always wherever I go. और मैं हमेशा बोलती हूँ कि निखरो तो फूलों की तरह और बिखरो तो खुशबू की तरह। ये याद रखेंगे, आप जहाँ मर्जी जाइए, वर्ल्ड के किसी भी कोने में जाइए, आप ज़रूर यही करते रहेंगे। और ये करने से जो हासिल होता है, जो खुशी होती है, वो आपके चेहरे से रिफ्लेक्ट होती है। वो आपका कोई भी अननोन फ्लाइट में भी मिलेगा ना, वो भी देख पाता है और वो इन्फ्लुएंस करता है। तो ये जो जादू है ना, नॉर्मल बर्थ कॉन्सेप्ट, जो मैंने अर्चना जी को मांगा कि मेरे को तो कॉन्सेप्ट पे बात करनी है, अगर आप मुझे बुलाना चाहते हो तो मैं कॉन्सेप्ट पे बात करूँगी, नेचुरल बर्थ के मैकेनिज़म्स, वेज, स्टेप्स, एवरीथिंग विल बी डेल्ट बाय मैनी पीपल, बट मैं एक छोटा सा जादू बता के जाऊंगी। वो जादू लाइफ में भी काम करता है और नेचुरल बर्थ में भी काम करता है। तो इन्हीं शब्दों के साथ मैं अल्प विराम देती हूँ अपनी वाणी को, और फिर से मुलाकात होगी अगले सेशन में, जब मैं आपसे फिर बात करूंगी अपने टॉपिक पे, नेचुरल बर्थ। थैंक यू सो मच।
थैंक यू मैम, थैंक यू सो मच फॉर योर मोटिवेशनल वर्ड्स। अभी से हम सब इन्फ्लुएंस हो गए मैम आपके वर्ड्स से, सो थैंक यू वेरी मच मैम।
I request Mrs. Manita Acharya ma'am, Professor, Baba College of Nursing, to present a memento to our respected guest of honor, Professor Dr. Usha Ukande ma'am, Education, Cerumax, Nursing College, Indore, Madhya Pradesh. Thank you, ma'am. Now I request Professor Dr. Usha Ukande ma'am to share her valuable thoughts with the gathering.
Good morning. Respected dignitaries on the dais and my friends in the audience. I know time is very short and we are going to have session. Thank you. First of all, I also came here because Archana asked me, and Archana is from Indore. And another thing that I and Manju were discussing is that Niramaya, yes, this college is one of those colleges who has taken up, government of UP has recognized them. So thinking what is it, and second reason was that this is on natural birthing, and I had the privilege of starting natural birthing center in my hospital, one of its kinds, in a private hospital with the help of 2 UK personnel. One was Susan Bewley, the obstetrician, and another Deborah Beck, the midwife. They came thrice to our hospital and we all worked together. One of my colleagues is sitting there, Sushmita, who was our midwife, who had worked 3 years there. And we were successful. As Manju said, if something comes to your mind and you want to do it, the whole universe conspires to make it happen. For with us also the same thing happened. So I am very happy to share my experience. I will be sharing that experience in my talk that is going to follow. And another thing that I wish to say is, I am also fortunate that I have recently been, I have taken over as Society of Midwives president. You people didn't mention, I feel it an honor because in these next 4 or 5 years, I am sure things are brewing up. Like in March, we had a conference here, SOMI's national conference in SGPGI. That was also on natural birthing, and this conference is also an international conference on natural birthing. Things are really happening, things are ripe, and we together, Society of Midwives and you all, and as Manju had a talk with the director Saab, I'm sure UP is going to be the pioneer in reality starting the natural birthing concept in the whole country. So thank you very much. I'm not going to take your more time. I'll be talking more when I am taking the session after this. Thank you, and all the best for this conference for all of us. Thank you.
Thank you very much, ma'am. Now, I request Mr. Ankur Sharma, sir, Professor, Assistant Professor, Baba College of Nursing, to present a memento to our director, sir, Mr. R.K. Bajpai, sir, the patron of our conference, founder of Baba Educational Society, president of UP Nurses Association. He is a great leader and his vision is the reason for our success. Thank you, sir.
Now I request Mrs. Manila Bibin, ma'am, Assistant Professor, Baba College of Nursing, to present a memento to our respected Principal, ma'am, Professor Dr. Archana Chauhan, Ma'am, the chairperson of this conference, she is capable, profoundly qualified, and dedicated towards her responsibilities. We are really blessed to work under her guidance and mentorship, and we are growing professionally each day under her supervision. Thank you, ma'am.
Now, I request Mrs. Anjali Chaturvedi ma'am to present a memento to Mrs. Bhumika ma'am, Secretary, State Branch, UP, TNAI. Thank you, ma'am.
Thank you all our dignitaries and director sir and principal ma'am. When creativity melts together with global issues, I believe you can bring the world together. Now, we are giving 10 minutes break for our dignitaries and we'll start our session after 10 minutes. नायक जय हो भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा हायल उत्तराखंड विद्या हिमाचल यमुना गंगा तब शुभ नामी जागे तब शुभ आशीष मांगे काय जन
माता की जय.
Jai Hind. So we'll be soonly meet after 10 minutes break. Curtain लगा दो curtain. इसको ऑफिस में नहीं ले जाना वो सोफी डियर को ले जानी है हाँ ये वो उसको ले जाती है अच्छा ठीक है बेटा मुझे बच्चे साथ खड़े होने पर नहीं अब तो हो गया सक्सेसफुल अब कोई दिक्कत नहीं है मेरा
you. I have seen with my own eyes as a young girl, my chachi used to do this work, and how she used to do the rotation of the head. And I was surprised that doctor said that it is not going to be a natural birth, but still she did it. That time I could not understand that what has happened, but now I understand that what Keelands used to do, she was doing it manually. Some practices were not safe and are not safe according to us, but they were doing, but I learned from them. From these people I learned that how to prepare a mother during antenatal period to deliver normally, naturally at the time of labor. Because that is not the time, if somebody wants that during labor they came suddenly and they want natural birth or normal, it's not a magic, it's a process. And process is a slow process, but it's successful process if you adopt it. And then the concept which I wanted to tell, and because of that I said no, I'm going to present that. Slides will come later, and these slides might be a repetition in some of the presentations which I was looking at the topics later to just now, might be a repetition. But the way you interpret it, the way you want to understand it is different. What I am telling you, the old thinking and empowering mothers, is nothing but a switching off the neocortical to limbic brain. Neocortical brain बहुत logical, limbic हमारा जो limbic primitive है वो जो pleasure, all that, it deals with that brain. So we are switching off one side and we are switching on the other side, which helps to relax mother. When she is relaxed, her muscles are working in a better system for us to deliver. And I am going to share with you the stories or the experiences which I have myself in working in labor room. And I must tell you that I was principal for many years. Now I am dean, but as dean also can go to the clinical side, but as principal I made it a point that I always go with my master students to labor room. And doctors were saying that this mother is very difficult, let us give it to the madam and students who are coming from Rufaida College of Nursing, Jamia Hamdard. So we used to take those cases because we wanted to experiment what we are thinking. We did not collect the data in a systematic manner, but that is why I'm not saying I'm presenting evidence. I'm saying I am sharing experience. That's what is the experience, that if you explain it to the mother with full compassion, empathy, you should first feel it that I can deliver her normally. That's the first starting point. My international colleagues will agree with me. That's the point from where the natural birth starts. That you have to think. I am a teacher, so I use those skills as a teacher to do that, don't mind it. So what I was telling, that first point, starting point of natural birth starts that a midwife has to feel that I can deliver naturally this mother. That's the first feeling. With that thinking, she will talk to the mother from the antenatal period, and then she will teach her the skills, exercises. Her thinking also will start from that time itself. She has to think that she is going to deliver normally. If she is thinking, oh, I don't know, होगा कि नहीं, पता नहीं मैं कर पाऊंगी कि नहीं, नॉर्मल होगा, मेरे में इतनी शक्ति है, ये अगर डाउट्स शुरू से होंगे then it is not working. You have to उनको एक विश्वास और उनके मन में ये डालना डे 1 से बहुत ज़रूरी है. अगर वो करेंगे तो वो धीरे धीरे ग्रो होगा, और दैट इट सेल्फ ओनली लीड्स टू द पावर. डू यू थिंक दैट किसी को इतनी पावर होती है? आप देखते हैं कि वो एक अभी आया था ना टीवी में शो, 80 किलो 80 kg दांत से उठाया था. उसको पूछा कि आपको इतनी शक्ति कहाँ से आई है? उसने कहा हौसलों से उड़ान नहीं होती है, मतलब हौसलों से उड़ान होती है, पंखों से कुछ नहीं होता. मेरा इतना बुलंद है ये विश्वास कि मैं उठा सकता हूँ, मैंने उठाया. एक गांव से था हरियाणा के. What I am trying to tell you is that you have to make them understand that you have that power, innate power जिसको हम बोलते हैं, innate power in a woman that she can really do it. First is that point. If that is clear, then there are various ways which in my presentation and in others also you will learn that what are the ways and how are you going to do it from the antenatal period itself. That's the beginning, and let's start the presentation. With this prelude, with this understanding, with this note, I want to start. And what we are going to see is, in this physiology of the birthing process concept, which I have explained in my own words, need of pain relief during labor. If we want natural birth, then we need. Then factors triggering pain during labor, managing pain triggers, natural birth education, 10 steps to natural birthing, and midwife's role. Some of the points I feel that will be a repetition because others might be covering, but I'll just touch them, not go into details of that. As you know that birth of a human being is a natural physiological process. जब हम menstruation सुनते हैं तो हम बोलते हैं ना menstruation अरे कुछ नहीं है, इतना परेशान मत हो, ये एक normal physiological process है ये भी. तो birth भी equally similar way है. हमको अगर सोच वही रखेंगे कि वो भी वैसा ही है process, normal है, physiological process है वो भी, तो then you will be able to understand and make others understand. And a normal physiological labor and the birth is one that is powered by the innate human capacity of the woman and the fetus. That's what I was telling you, that it's innate, inborn. वो अंदर already है वो शक्ति, खाली आपको realize कराने की ज़रूरत है, वहाँ पे वो already है. जब आप काउंसलिंग करते हैं, आपका साइकेट्री भाषा में बोलेंगे, जो आप उनको जो टीम काउंसलिंग, दिस काउंसलिंग ये भी करते हैं, इसमें क्या करते हैं आप? उन्हीं के तो इन्नेट को ही तो बाहर निकालते हैं. तो यहाँ पे भी वही सेम चीज़ करना है हमको. एंड लेबर पेन्स कम्स एंड गो एंड दे कैन लास्ट फॉर अ फ्यू डेज, कैन बी इरेगुलर, रेगुलर, माइल्ड, मॉडरेट एंड स्ट्रॉन्ग. एंड इन द फर्स्ट स्टेज ऑफ लेबर, pain is caused by the distension of the cervix and lower uterine segments in combination with contraction of the uterus, which is oxytocin plays a major role in that. And then pain is the second stage of labor is dominated by tissue stretching in the pelvis and perineum. That's the introduction. And then concept of natural birthing. The way I told you that natural childbirth is a process in which the need for anesthesia, sedation or surgery is eliminated through physical and psychological conditioning, which we do this conditioning by different ways, but utilizing their own powers. They have those powers. We are only making them realize. Until the early 20th century, these terms have been used as synonyms, natural and normal. And recently I attended the normal birth and labor conference in UK. It was in Cumbria in April. I attended that, and there we had a great interaction with all midwives from different parts of the world. And they presented different their studies, and they bring out the evidence. For example, one study where I was there in the panel, that was the size of the foot, your shoe size, and the correlation between the size of your pelvis and normal birth. So that we always say, but in India we are not collecting that data. So she was ready that if in India we get this data, it can be, we can say that generalization is possible in India very easily because the numbers are so huge. If we do it in all labor rooms, I think that data will be ये छत को भी फाड़ के निकल जाएगा, इतना डेटा हमारे पास होगा. और हम क्यों बहुत सारी स्टडीज़ का जनरलाइजेशन नहीं कर पाते हैं, क्योंकि हमारा वो नंबर नहीं होता है डेटा में, इट इज़ लेस. सो आई थिंक small studies I can share later on with your principal madam, that what all I have seen those studies, small ones which they keep on doing and making it strong. जो knowledge base है professional, they make it strong by doing small studies. And effect of yoga, effect of meditation, effect of music, effect of aromatherapy, effect of so many things which we do, and we know that it is leading to the change. But we are not collecting systematically the data. That is why we are not presenting it as evidence, we are presenting it as a experience. So I think youngsters sitting in this room, whatever therapy or the actions you see in natural childbirth, take up each one, start doing it, and do it a longitudinal studies on these, because these will not be a cross-sectional, अभी थोड़ा सा किया और ख़त्म हो गया, रिजल्ट आ गया, नहीं हो पाएगा. यहाँ longitudinal studies की ज़रूरत है. और वो करने के बाद मैं दावे के साथ कह सकती हूँ, जो हम बातें मैंने अपने एज अ गेस्ट स्पीकर के वक्त में तब कही थी, वो बहुत सच है और वो आप करके दिखा सकते हैं. सो दैट इज़ व्हाट इज़ रिक्वायर्ड. एंड इन 1993 जो यहाँ पे हम कोट कर पा रहे, ये इसीलिए कर पा रहे क्योंकि दे जनरेट एविडेंस, हम एविडेंस जनरेट नहीं करते हैं. The British obstetrician Dick wrote a book entitled Natural Childbirth, in which he postulated that excessive pain in labor result from muscular tension arising from the fear of the birth process. जब इन्होंने 1933 में ये postulate किया तो इसको prove किया, और इसी से उनका ये निकल के आया कि हम अगर fear of unknown जो mothers को होता है, स्पेशली प्राइमी मदर्स को फियर ऑफ अननोन होता है ना, उससे मसल टेंशन होता है, और जो डिलीवरी प्रोसेस है, जो सर्वाइकल डायलेटेशन है, सॉफ्ट टिश्यूज़ हैं जिनको डायलेट होना है, वो स्लो हो जाता है. पर अगर वो फियर ऑफ अननोन ड्यूरिंग एंटीनेटल पीरियड यू मेक हर अंडरस्टैंड थिंग्स. जब मुझे कुछ पता नहीं है तो मुझे डर लगता है ना, जब मुझे वो चीज़ पता है तो मैं उसके लिए मेंटली प्रिपेयर होती हूँ. बिलीव मी, माई माइंड, नॉट माई माइंड, आई एम टेलिंग यू, ईच वन सिटिंग हियर, माइंड हैज़ कैपेसिटी ऑफ वर्किंग ऑन 8 थिंग्स साइमल्टेनियसली. एट प्रेजेंट ऑल्सो you must be doing it many things, but you are not realizing. Some mothers must be thinking about the child also, what he must be doing, listening to me also, and seeing around. गर्मी है, सर्दी है, ये भी देख रहे हैं साथ में. तो 4 चीज़ें तो इस वक्त ही आप लोग कर रहे हैं, बहुत सारे लोग आप में से कर रहे होंगे. मैं यहाँ पे बोल रही हूँ और कोरिलेट कर रही हूँ अपनी स्टडीज़ को, मेरे बैक ऑफ द माइंड 4 चीज़ें और चल रही हैं. What I am trying to tell you is that this machine is with everyone, and this machine has capacity to do at a time 8 things. हमारे जो भी religious या spiritual gurus हैं, they all have proved it. They all have proved it, not by again by scientific research, but yes, they have done it. Practically they have done it. So इसीलिए इन्होंने जो कहा डॉक्टर डिक ने, हम वो आज भी हमको कोट करना पड़ता है, क्योंकि हमारे यहाँ अभी डिक पैदा नहीं हुए, उनको एविडेंस कलेक्ट करना है. सो आई एम गिविंग दिस चैलेंज टू ऑल ऑफ यू दैट if you do it, please do contact me and tell me that you have collected this evidence. Do it. क्योंकि ये कोई बहुत नई बात नहीं थी, पर क्यों इसको हाईलाइट करना पड़ा कि उन्होंने जब ये पॉस्टुलेट करके बताया, तो देयर आर एक्टिविटीज़ और इम्प्लीमेंटेशंस विच स्टार्टेड इन एंटीनेटल केयर, कि उनको आप अवेयर कराओ, लेबर रूम में जब सिजेरियन के लिए भी भेजो, इसी से निकल के आया दैट यू हैव टू एक्सप्लेन द प्रोसीजर, व्हाट इज़ गोइंग टू बी डन ऑन हर, हाउ OT और लेबर रूम looks like, explain all that. That is what he proposed, that every pregnant woman should attend a course of study to learn more about the birth process and to be instructed in breathing techniques and relaxation exercises useful during labor. इसलिए उन्होंने कहा कि ये सब चीज़ें उनको एंटीनेटल पीरियड में सिखाई जाएं. So आपको क्या लगता है कि डीप ब्रीदिंग और ये जो रिलैक्सेशन एक्सरसाइजेज हैं, क्या ये इंडिया के लिए नई है? ये बहुत पुरानी है, एजेस ओल्ड हैं ये. और आपने देखा होगा कि हमारे पुराने लोग बहुत बहुत ईयर्स भी जीते थे. अभी भी हमारे देश में 112 साल का मैंने देखा 92 ईयर्स की हैं जो अभी मैराथन में वो शॉट पुट करके आई थी लेडी. उन्होंने सिल्वर या गोल्ड जीत के आई थी अभी हरियाणा से. तो ऐसे वाले एग्जाम्पल्स हमारे यहाँ बहुत सारे हैं जो ये सब करते हैं. दिस इज़ माइंडफुल ब्रीदिंग विच ये जो शब्द है ये बड़ा कैची, बड़ा फैंसी लगता है, पर ये भी बहुत पुराना है. Conscious thinking turns off the primitive system and allows the woman to give quickly and painlessly. And if a woman could turn off her thinking, her neonarcotical brain activity, a phenomena known as fetus ejection reflex could happen. That's Dr. Ordent. And need of pain relief during labor. What is the need of pain relief during labor? Because labor is actually, each individual is different, each individual. Therefore, labor is also different for every mother. And as she said in the beginning, that it's not about the fetus or delivery, it's about becoming a mother also, because then she becomes a mother. And it varies widely from woman to woman and from pregnancy to pregnancy. आपकी भी 2 pregnancies में similar experience नहीं होता है. You have different experience, even of pregnancy and delivery both. Labor pains are considered as positive pain. एक ही मैंने दुनिया में ये दर्द और पेन सुना है जिसके लिए जब नहीं होता तो ऑक्सीटोसिन क्या ऑगमेंट करते हैं, ऑक्सीटोसिन से बढ़ाने के लिए, पेन देने के लिए कोई चीज़ पहली बार होती है. ये बहुत ही आश्चर्य है और आज तक भी ये मैजिक ही है. दैट दे डू नॉट लास्ट फॉर एवर, क्योंकि ये पेन हमेशा नहीं रहता. और द आउटकम इज़ the birth of the baby, which is very positive and joyous event. That is why this pain is welcomed by everyone. They want to have this pain. Only thing is they need to be prepared for this pain and how to take care of this. How to utilize, in fact, I would say, how to utilize this pain strategically. जैसे strategic management होता है, ये भी एक तरह का स्ट्रैटेजिक मैनेजमेंट है कि आप इस पेन को किस तरह इस्तेमाल करेंगे कि आउटकम फटाफट भी हो और बढ़िया भी हो, दोनों चीज़ें. तो द प्रिपरेशन फॉर चाइल्ड बर्थ शुड स्टार्ट फ्रॉम एंटीनेटल पीरियड बाय इंट्रोड्यूसिंग द वुमेन विद हर बर्थिंग कंपेनियन. अभी हमारी एक गाइडलाइंस में पुटिंग बर्थिंग कंपेनियन वॉज नॉट ईजी. I am working as a natural birth advocate in India since last 2 decades, completely more than that, but 2 decades, yes, dedicatedly. And this was the point for which we had to fight with the ministry to include it in guidelines, all guidelines for SBA, for now skill birth attendant program and all those things. These guidelines are there in respectful maternity care. I think Renuka is going to speak on respectful maternity care. There also now it is included in that guideline also. So certifying any labor room as a कौन सा labor room Lakshya program के under, at this point is very important indicator. Even including the respectful maternity care in those guidelines was not easy. So I am executive member of White Ribbon Alliance India also, and we were working as advocacy partner with ministry to include it in these guidelines that RMC word बोलना चाहिए, सबको आना चाहिए. फिर INC ने तो later on include कर दिया, but first it was the ministry who did it, and they understood it, what is the importance of this. Because if you are not respecting your mother, she will be in little tensed, this thing. Hormonal system works very positively in labor. If she is tensed, then there is a problem. That again neocortical and limbic system is coming into action. So she should not have that stress. She should be respected. Her opinions, her choices should be taken care, and she should be given information whatever she is asking for. And companion is very, very important now. It was important शुरू से, पर अभी तो guidelines में, इसलिए हम लोग कर सकते हैं उसको, ये बात है. Factors triggering pain during labor, others might also discuss this because I have seen a separate session is there on this. So we will just touch it, that direct and indirect. Or direct जो है contractions of the uterine muscles, stretching of the ligament, pressure of the fetus on the uterine cervix, bladder and bowel, and stretching of the birth canal and vagina. Indirect is bright lights, loud voices, noises. लेबर रूम में क्यों थोड़ा सा अंधेरा नहीं रख सकते हैं? हम रख सकते हैं ना. अगर जब डिलीवरी हो गई हमको कोई विजुअलाइज करना है, अगर टीयर ब्लीडर, उस टाइम हमारे पास वो दूसरी लाइट होती है ना, फोकस लाइट होती है, दैट कैन बी यूज. पूरे लेबर रूम को, हेलो, कुछ हुआ? ओके. तो पूरे लेबर रूम को इतना तेज लाइटें, इतना सारा नॉइज, हर कोई टॉप ऑफ द वॉइस में चिल्ला रहा होता है. डॉक्टर इज शाउटिंग, आया इज शाउटिंग, नर्स इज शाउटिंग, and the worker who is coming to look after the AC is also shouting. So, but I saw very nice labor room in India, only Baroda. Fernandez also they have, but Baroda I visited, which is a government institution, and I saw that they have practically done it. They keep lights very dim. Lights are dim, ऐसा लगे वो cooling effect देता है ना, हल्का सा म्यूज़िक चलता रहता है. म्यूज़िक एक्चुअली शुड बी अकॉर्डिंग टू द चॉइस. किसी को रिलैक्सेशन होता है ढम ढम सुन के, किसी को रिलैक्सेशन होता है सूदिंग इंस्ट्रूमेंटल सुन के. सबका म्यूज़िक में डिफरेंट टेस्ट होता है ना, सबके रिलैक्सेशन का वे डिफरेंट होता है. तो उन्होंने वो भी लगाया हुआ था, और प्राइवेसी वॉज वेरी वेल मेंटेन. शी वॉज नॉट अफ्रेड कि कौन घुस जाएगा अंदर सडनली. दैट शी वॉज नॉट हैविंग फियर. सो that small thing, एक छोटा सा very small thing I am telling that Karen and others will also agree with me, that very small thing, that if mother has that fear that somebody will enter in, barge in, anybody will come in, that itself keep her in a very tight position, and that doesn't allow the good outcome in labor. If she knows that no, nobody will come unless is given the right, only my companion, my midwife or my obstetrician is here, nobody else will come unless they ask me. That surety gives, and you can check all these smaller observations or points with your research. I am giving you this open thing that you do it, you will be ascertained, you will be sure of that, that yes, that was right. Please do it. बड़ा बड़ा रिसर्च करने का ज़रूरत नहीं, छोटी छोटी चीज़ पे करिए, बहुत बहुत हेल्पफुल है दिस इज़. एंड कमिंग टू दिस, शी इज़ जनरली ऑल्सो टायर्ड. unfamiliar environment, which we should try to familiarize her. Fear of unknown, again, physiological, emotional, personal issues may be there, which we do not know. Dehydration, क्योंकि many hours she has been starving. That's also one very bad thing which happens in most of the places, that they do not take care of this small thing, that how long it has been, when was the last feed, when was the last drink. these questions are not there in history taking pro forma. Okay, so these are missed. How important, because if you look at these triggers, and I'm telling you that you can write management or you can do management if you look at each one and write the means or measures of managing it. How to overcome the bright lights, not difficult thing, loud voices, noise, go and stop it. It will be stopped. Okay, so try to focus on smaller things which has bigger implication. They are very small if you just look at it with these eyes. But if you look at it deeply, they have great implication, great effect on the outcome. That is why they are to be seen. This also I will not, because I am sure the pharmacological interventions will be there. This was not important for me, and I don't give much importance to this being a natural birth advocate. That's also the reason. Reducing direct triggers, as I told you, we can do a lot. Back massage, this everybody must have. जो हम BSc में भी सिखा रहे थे कि sacral massage करो, sacral massage करो. I am telling you my own experience that when my husband was doing sacral massage, oh, I was thinking that this is the only thing I want. I don't want diamond, I don't want gold. I want only sacral massage. Can you imagine how important it is? That means everyone, last person sitting in this hall, please raise your hand and say you agree with this. You don't want diamonds that time when the pain is there. Oh, उन्होंने मुंह क्यों छुपा लिया, बाल खुले हुए, last I can see each one. I am a teacher, and teacher has this skill as well. 100 भी बैठने दीजिए, उसको सबको ही दिखता है, कोने वाला इधर ऐसा बैठा, उधर वाला ऐसा बैठा, सब दिखता है, लग रहा है कि इधर ही देख रहे हैं, है ना? ऐसा ही यही टीचर होता है. गुरु का जो हमारे देश में महिमा है वो इसीलिए है क्योंकि उनकी 2 आँख छोटी छोटी है लेकिन बहुत कुछ देख सकती है ना? एक्सप्रेशन भी, उन्होंने अभी तक भी हाथ ऊपर नहीं किया. लास्ट पर्सन सिटिंग इन दिस हॉल, एक्सट्रीम लेफ्ट. ओके, इट्स फाइन. Then counter pressures, that also works very well. Acupressure on specific areas. We did a study, one of my master student did a study on, it was on postnatal, that effect of acupressure on backache. Backache hota hai na postnatal period mein, very common problem. So she did a study on effect of acupressure on backache, and the results were very encouraging. She first learnt acupressure, 3 months training kiya, uske baad she started that study. So that is working in postnatal also, in natal also. And immersion of the in the warm water, warm or contrast hot and cold shower, application of the hot water bottle, cold packs, changing positions and finding the most comfortable or applying the specific some exercises which helps. And these are the pictures which I have taken from Meerut. So I want to acknowledge that. Yeah. Managing indirect pain triggers, that also I would tell you that we did a study on music therapy. Music therapy was classical music we played in labor room and asked the mothers, those who liked that, only for them in one room. And again the results were very, very positive. Music therapy works. And then dimmed light we have not done, but I think you should do it in one room, labor room you can have this, and other room, all direct, indirect triggers. Try to work out on those where it is possible, and that's what I'm going to do in your Baba Institute, lot of studies, and see that how you are generating the research data. Then only my trip will be successful, otherwise no. And surround the mother with the familiar faces. That is why birth companion concept and midwives, the continuum of care which is not happening or possible at present in India, because it has got a lot of value. अगर मुझे day 1 से जो मिला वो मेरे डिलीवरी में भी है, मेरे पोस्टनेटल में भी है, उसका अलग ही महत्व है. वो होने तक हम काम करेंगे ही करेंगे, और ये हो जाएगा, ऐसी बात नहीं है. बहुत साल पहले हम मिडवाइफ बात करते थे तो लोग हमको कहते थे शट अप, व्हाट इज़ मिडवाइफ. Our regulatory body people were saying this. Why are you talking of midwives? Only nurses. Now they are also talking. So how nice, wonderful world now. We feel so happy and proud and privileged that yes, they are also becoming advocate. That's what we wanted. We never wanted to fight with them. We wanted them to do what we are telling based on the evidences that yes, it is good. So that's what is required. Natural birth education, it's a comprehensive program actually, and it is not possible to justify that in 45 minutes, talking so much, a person standing here talking so much about many things, because I feel that so many audience I got, let me give this information also, that also, that's the reason. But I am sure that they will be talking about Lamaze technique, water delivery, Alexander technique, Bradley method, hypnosis. Hypnosis मैंने पूरा अपने मॉर्निंग सेशन में ही बता दिया था, वही hypnosis होता है. उसको ये विश्वास दिला देना कि तो you can do it, और concentrate, focused concentration, mindful meditation कराना उस समय कि क्या इमेजिन कर रहा है उसको कि अभी बेबी इतना नीचे आ गया, अब इतना आ गया, थोड़ा और पुश करना है, इट इज गोइंग टू बी आउट, बेबी इज इजेक्टेड. दैट इज इजेक्शन hypnosis. That already I have explained, and others I usually spend half a day on Lamaze, half a day on other techniques. So she's smiling. I think she is convinced that yes, is it right? It needs lot of time. But इसको अगर मैं शॉर्ट में बताना चाहूँ ना तुमको, लमाज कुछ फ़र्क बहुत अलग चीज़ नहीं है, खाली ब्रीदिंग पैटर्न्स हैं वो, हाँ. उसमें 1 2 3 4 डीप ब्रीथ किया, फिर आउट करने के वक्त में और 6 तक करना है, और काउंट मत करो, आवाज़ निकालना चाहिए. क्योंकि वो आपका जो चिल्लाने के लिए क्यों मना कर देते हैं पता नहीं लेबर रूम में. मदर को शोर करने का अधिकार है, आपको नहीं है. क्योंकि जब वो चिल्लाते हैं, मतलब शोर करते हैं, वो करने देना है उनको. अभी करने देंगे सब कहते हैं चुप रहो, मुंह बंद करो. ऐसा नहीं करना प्लीज. दैट इज नॉट ओके. अलाउ देम. दे आर नॉट टेकिंग योर एनर्जी, इट्स देयर एनर्जी. लेट देम कंज्यूम इट. Okay, so सब करने देंगे हम. Oh, that's great, wonderful. If I don't speak anything about Lamaze, it's fine. Okay, so these are the words, and there is a YouTube link which I think I should not be playing it now, but in between अर्चना जी जब भी टाइम मिलेगा तो इस YouTube लिंक को खोल के उनको दिखा दीजिएगा. दे विल अंडरस्टैंड लमाज. उसमें हम ये बिलीव करते हैं कि लेट लेबर बिगिन ऑन इट्स ओन, वॉक, मूव अराउंड एंड चेंज द पोजिशन थ्रू आउट लेबर, bring a loved ones, whatever we have seen, almost it's a repetition, and these are the beliefs for Lamaze. And it's by a Russian, began in Russia, and Russian prophylaxis को FI लिखते हैं वो लोग, PHY नहीं लिखते हैं, तो वही वर्ड सेम लिखा हुआ है, prophylaxis. It was developed by them, and it's working. Lamaze also, one of my master student did it, Lamaze in Srinagar. She did it in Srinagar, and when she came to know that this works so wonderfully, she was very senior person but came for masters quite late, so she thoroughly enjoyed collecting data on this. So you can read that study also, it was published, Lamaze. she published it. I try to do it small studies with my master students because we don't get time even though we would like to do it. So they do it, but again generalization is not possible with that small numbers. That's the limitation or constraint we have. Water delivery also, I think one of the person expert is here as a speaker who is going to talk. Here buoyancy is the major thing which helps to alleviate the discomfort and pressure. Physics में सबने buoyancy पढ़ा था ना, buoyant force, experiment भी एक कराया था फर्स्ट ईयर में जब हमको बायोफिजिक्स पढ़ाते तब भी कराते हैं वो. So that same principle works here and it helps to relieve the pain. और एक और अच्छी चीज़ इसमें होती है कि बेबी को सीधा काइंड ऑफ क्लोज्ड वाटर से जहाँ से निकल रहा है वो उसी वाटर में आ गया तो उसको भी अकोमोडेट होने के लिए उतना मुश्किल नहीं होता. एक स्टेप क्लोज से थोड़े ओपन में आया, ओपन के बाद फुल एनवायरनमेंट में आया. सो दैट इज़ ऑल्सो गुड फॉर बेबी फ्रॉम दैट पॉइंट ऑफ व्यू. Alexander technique is nothing but our all body movements balances our head, neck, spine. These three are the you can say pivotal points by which our आपने खुद को भी देखा है ना कई बार कैसे बैठे होते हैं हम ध्यान नहीं देते. Same is happening with the pregnant women also. They sit like this. So what happens here? Spine. When you are most of the time looking at your mobile, your neck, head. These postures also determine the muscular tension increases because of this, and he utilized only this important point that if these three are kept in alignment, the muscle tension or the pain because of this happens will be taken care. So that's the Alexander technique. Bradley also developed a method in 1940s, Dr. Robert Bradley, and the इसमें जो husband को training क्यों देते हैं वो लोग, क्योंकि husband coached natural childbirth, so husband is also explained everything. It is again a course. It is not possible. I'm just touching so that you search and you study now in details. जब उन्होंने कहा कि 12 हफ्ते का कोर्स है तो इसका मतलब बहुत कुछ पढ़ना होगा ना, बहुत कुछ सीखना होगा. एक लाइन में बताने से तो होगा नहीं. अगर आज आप ब्रेडले मेथड, अलेक्जेंडर मेथड, लमास ये याद करके रखेंगे और फिर ढूंढेंगे खुद, I am sure you will enjoy reading, learning about it. So that was only the objective of bringing these slides. Not that I can teach everything by standing here, no. It takes time. We are ready to do it, but then Archana ji has to give us lot of time. Okay? This switching off thinking method, this I have explained, I think in Hindi bhasha, English bhasha, और मेरे नॉन वर्बल भाषा में भी बहुत सारा ऑलरेडी बता दिया कि क्या लिम्बिक है, आपका कौन सा यहाँ पे स्विच ऑन ऑफ करते हैं. जब आपको मेडिटेशन कराते हैं वो क्या कहते हैं, क्लोज योर आइज, लेट्स गो टू द बीच साइड. बीच पे पहुँच गए, पहुँचे आप लोग कि नहीं? और पहुँच जाना चाहिए था, बिकॉज इट इज़ वेरी फास्ट, इट वर्क्स वेरी फास्ट. रीच द बीच साइड, हियर द साउंड ऑफ दोज, लहरों का वो सुनो, कितना मज़ा आ रहा है, काम हो गया. नाउ कम बैक. सो स्विफ्ट, फ्रैक्शन ऑफ सेकेंड्स, इट टेक्स फ्रैक्शन ऑफ सेकेंड्स. सो दिस इज़ वॉट, उसको इमेजिन क्या करा रहे हैं पिक्चर में, बच्चा आने वाला है, आपका बच्चा इतना नीचे आ गया, अब थोड़ा और आया, आ गया आ गया आ गया, ऐसा. ओके, दैट्स हिप्नोसिस. एरोमा थेरेपी इन लेबर रूम इज़ ऑल्सो practiced many places, and it has an analgesic relaxing effect. And again I would say that this therapy is adopted by, again for limbic brain, and this that your rational brain should not work at that time. That is why we did a study on using the lavender tea, not the therapy जिसमें एरोमा वो कमरे में रखते भी हैं ना लैम्प्स और ये सब भी, that can also be done. We did it on lavender tea. One of the other master student did on lavender tea, and it also showed the similar results what we read in the literature. So it was in tandem with the other research works done. These studies, believe me, my students feel that this lady always tells us very challenging studies. So that I am famous for, but then I have studies to quote and I can speak with that conviction. You also will speak with conviction when you are getting it done and or you are doing it. That's the importance, and we have quoted here also. Lavender is the commonest thing which I have seen in India. There are other things also. Peppermint is also can be used. Yes, peppermint is another thing. These 10 steps are nothing new, which we have not talked earlier. Choose a supportive practitioner, very, very important. प्लान करना अपना डिलीवरी की किससे कराएंगे, कहाँ कराएंगे, कैसे होगा, कौन कौन होगा, क्या सामान ले जाना होगा और कितना खर्चा हो सकता है, और अनफोर्सीन कुछ कॉम्प्लिकेशन, प्रिपरेशन, एवरीथिंग शुड बी डन. हमारा भी बर्थ प्लान में SBA गाइडलाइंस में लिखा है माइक्रो बर्थ प्लान. सो दैट्स व्हाट इज़ ऑल्सो वन ऑफ द स्टेप. Selecting the birthplace, then have a birth plan. Then doulas I have written, okay, but we don't have in India. डोला का मतलब ये था कि जिसको खुद को एक्सपीरियंस है ना, वो समझेगा. जैसे मैंने कहा सेक्रल मसाज, दैट वाज द पॉइंट. यूज ऑफ डिफरेंट पोजीशंस. Then birth ball is very useful. This also, this study now this year I want some student to do it with me. Use of birthing balls. And उसमें क्या होता है, वो जो ऐसा करके हमारा बर्थ कैनाल कैसा है, गटर शेप. इट्स नॉट स्ट्रेट एज अ रोड नहीं है वो, ये प्रॉब्लम है एक. It's not a straight road, it's a gutter shape. So when you do it, dancing movements also in fact helps. ICM Bali, we did those steps of dancing which helps in bringing it down. So that is the reason. And get support from other like-minded friends and family. Learn about the pain relieving techniques. And role of midwives is definitely paramount, very important in natural birth. Be with the woman, and her safety is her priority, and act as an advocate and understand her physiology and spontaneity of birthing process. Communication bridge to the woman's need, and it reduces medicalization and spontaneous vaginal birth, reduce traumatic experience, satisfied, empowered, positive birthing experience. I think it's your photo, yeah. This I took from Meerut. I asked them. Surbhi is there. Surbhi is another person, a midwife, educator who is working in Meerut. And I was impressed by her. I met her in Bali, not in India. She's from Meerut, next to my door, but I met her in Bali. And we had a lot of discussion, and I took this picture from her. Yeah. This one I will leave for you, as I got the slip that 45 minutes are already over, which is too less. Midwifery-led care for every woman. This we prepared at White Ribbon Alliance. This pamphlet, it's a pamphlet. I have just scanned it and put it here. Please go through it. If possible, give them the printout of this, at least this, to know, to understand in short that who is NPM in India and what all she can provide, who is NPM, what is special about midwifery-led care by NPM, and NPMs to prepare and support, you means mothers, and also compassionate, respectful care, how she helps in her journey, and assured services package, क्या package वो मिलेगा. ये it was not possible to cover each point, but I definitely want you all to know about NPM program, how, what they can do, what all is their responsibility. And that's all from my side. Thank you so much for patient hearing.
Excuse me, ma'am. Thank you, ma'am, for imparting your wisdom with us. It will definitely going to foster our understanding. Because of her busy schedule, Manju ma'am has to leave now. So I request our principal ma'am, Professor Dr. Archana Chauhan, to present her memento and certificate. So ma'am, please. Thank you so much.